Okay, hello, welcome to this video. We are going to be talking about another article from Newsday about New York State budget adding mental health services, which sounds like good news, but it's really pittance to solving the real problems. And I'm going to talk about this because it's another thing that South Shore 12 should be covering if they actually felt like covering news. But they're not a news station. That's the thing. They need to take news out of their title because News 12 Long Island is more like, that's why we call them South Shore 12, because they're not actually a news station or a lifestyle network for snobs. They don't actually cover news. And if you want Long Island news, I suggest you go to Newsday. And they actually have a streaming service called Newsday TV. I think you go to the Newsday site. I'll show you where it is. Let's show you where it is. Newsday. Show you where it is. So, Newsday TV. Go here, click on Newsday TV, and this actually take you right to Newsday TV. All right, so I just clicked on it there. So just look at it up here. All right, I'm not going to actually play it now, all right, because we're in the middle of a video. But that's where you can. That's what I would suggest you do if you want news for Long Island. And if you have a Roku, I think you can get it on your streaming TV as well. I got to convince some places to play that instead of News 12, because News 12 is a joke. Well, News 12 Long Island is a joke. The other News 12s are decent, except for the Long Island one. So anyway, that said, let's talk about this. So it says, Governor Kathy Hochul announces on December 6th funding for 13 certified community behavioral health clinics. The new state budget expands on mental health funding, providing for more than $400 million to better serve kids in schools, veterans, and the mentally ill charged with crimes. So the new state budget has increased funding for mental health services by more than $400 million to provide to better serve kids in schools, veterans, and the mentally ill charged with crimes, as well as addressing a shortage of care workers amid a growing state and mental health crisis. The budget provides funding across state agencies for mental health clinics in schools, more inpatient psychiatric beds at state facilities, and for the continuing mental health needs of veterans, first responders, and law enforcement and corrections officers. Whoops. So the State Office of Mental Health will receive an additional $118 million, bringing its budget to $4.9 billion. That compares with $3.3 billion in 2022 when the state began a multi-year plan to bolster mental health services, according to the State Division of Budget. The Budget Division said it couldn't provide an all-inclusive figure for total spending across all state agencies on mental health services. The state's priority to fund mental health services comes as more than 1 in 5 New Yorkers have symptoms of mental illness, including yours truly, and 1 in 10 adults and children face challenges serious enough to impact work, family, and school life, according to the state health department. Left untreated, the results include school failure, teen pregnancies, unemployment, divorce, suicide, and violence. Nationally, the U.S. Surgeon General determined the country is in a youth mental health crisis, including increases in schizophrenia and bipolar disorder, all exacerbated by the closely related addiction to drugs, including oxycodone, and I don't know why my computer keeps doing that, including oxycodone and fentanyl. It's a crisis, said Ramesh Raghavan, a professor at the New York University Silver School of Social Work and co-author of Investing in Children's Mental Health. The area is in need of particularly acute in youth. The crisis has prompted more funding by states including California and the federal government. New York's efforts ramped up beginning with Hochul's 2023 State of the State address. She called for a $1 billion multi-year investment after years of underinvestment, even before the pandemic. Given that we seem to have such enormous underinvestment in this country, any increase is very, very positive. So we have a big problem in this country with mental health funding, and I've spoken about that many times. However, Raghavan and mental health leaders providing care in the state also said a better balance is how funding is needed. For example, the state has focused on increasing the number of psychiatric beds in hospitals and psychiatric centers when community-based care works best for most patients. A psychiatric bed is a venue of care. It is not a type of care, he said, and we should be investing in more types of care. He said the state could better balance preventative measures, such as early intervention with youths. Half of all mental illnesses begin at age 14, with 3/4 starting by 2024, according to the state health department, citing national figures. Mental health spending under the Office of Mental Health, which provides services and administers most mental health spending, as well as under the Judicial, Education, Health, and Veterans Affairs departments, is the biggest accepted. I'm sorry. I'm a little tired, so I'm reading a lot here. So, as well as under the Judicial, Education, Health, and Veterans Affairs departments in the budget adopted Saturday include $33 million to expand mental health services for people with mental illness who are arrested. That includes $10 million to expand the mental health courts, which specialize in handling such cases. There are now 41 mental health courts in cities, county, boroughs, and counties across the state, including in Nassau and Suffolk. Hochul said Wednesday at a marathon news conference that the goal is to have special courts in all 62 counties. $20 million towards school-based mental health clinics statewide, and $19 million for the additional services for school-aged youths. Another $9.6 million will be used to continue serving youths within their community when possible. There are more than 1,100 school-based mental health clinic satellites operating or planned in the state's 4,771 public schools. $55 million to add 200 more inpatient psychiatric beds at state facilities, including 15 beds for youths. A doubling of funding to $2 million for suicide prevention by first responders, veterans, law enforcement, and corrections officers. $1.25 million to hire more staff in the Department of Veterans Affairs to process more claims, including those stemming from post-traumatic stress syndrome. By enhancing mental health supports, we're not just helping people find stability and peace, we're making our communities safer, said Hochul. The governor also, the budget also provides $244 million in funding to confront a workforce shortage that has reduced the capacity for care at non-profit service providers funded by the state, and delayed patient contact with psychologists and psychiatrists, sometimes for months. And this is something that's going on at my agency. We have trouble, especially getting housing workers. I haven't had a housing specialist in years, a regular one. I keep getting assigned one, and they keep leaving because I can't afford to live here. The budget includes funding for a 2.84 adjustment in the cost of living for most mental health care workers. The nonprofit agencies had called for a 3.2% increase. The budget also includes $4 million to forgive student loans for licensed mental health clinicians serving children and families who qualify for the program. Most of the state's frontline care workers are making between $25,000 and $35,000 a year, with a slightly higher pay on Long Island than New York City. So this is the problem. No one can live on that. No one. One of the guys I had, he had a share. He had a room. He had to share, and he was tired of it. I guess he got out of New York. That's what I mean. They can't survive on this. That wage has been mostly stagnant without a cost of living increase for more than 15 years, and this led to staff shortages, including one at an Albany nonprofit which has 1,500 workers and 2,000 vacancies. They can work with challenging people at times, and thanks to their salary, and thanks to the salary you can get at McDonald's. It's disgraceful. It really is. It's hard to stay in the job without rising up in the ranks or working 3 or 4 jobs, said Jahoon Kim, CEO of the In Unity Alliance Mental Health Care Organization and former staffer for Governor Hochul. But it's really just a start, but I'm a realist. So that's one article, and now I have another article about this. This is only in Newsday. Again, Newsday is doing the stuff that South Shore 12 should be doing. Community services, hospital beds, key for Long Island is in crisis. This is about the mental health crisis, and this was also from today. So it's tied to the other article I just read to you. So when Jeffrey McQueen thinks about how to provide mental health services to those who need it, he latches onto community-based care as opposed to inpatient psychiatric beds. And, of course, the improvement funding I read to you is none of it's going to the program I'm in, which is supported housing, and we need better apartments. We need more apartments, and the quality of the apartments we get is disgraceful. All right, but going on here, McQueen, executive director of the Mental Health Association of Nassau County, said that while there has been a push to boost inpatient psychiatric beds at a time of increased need for mental health services, he sees a reluctance among some to go to a hospital. If you ask someone, would you like to go to a hospital, their first answer is no, even if we recognize that they need a higher level of care. Some people balk because they fear being kept inside for an extended period. Others fear the stigma of being hospitalized for mental illness, or their cultural background eschews seeking out such treatment. So experts say the need for community-based mental health services has risen on Long Island. New York State investment in mental health services also continued to rise. More inpatient hospital beds for people in crisis, as well as increased community services, are the key. It's important that we normalize the conversation around mental illness and trauma, because it's important that people know nothing is wrong with them, but that something has happened to them. So to that end, he added, we have a hospital diversion program where people can go to a respite care instead of a hospital. The crisis respite care program also provides short-term assistance and intervention when someone's symptoms cannot be managed at home. But McQueen noted, sometimes a client's symptoms become too great to be managed in a community program. When an individual is supported first in the community-based organization and then guided into the hospital system or guided to that higher level of care, that individual is more likely to accept it, and in the end, the results are better. So mental health investment experts have welcomed the state's recent investment in mental health services. A $1 billion multi-year plan in the 2023-2024 fiscal budget, with approximately $118 million in new money included in the recently approved 2024-2025 budget. But the experts also point out to a serious need for expanded community-based programs to cover gaps in service across sprawling geographic areas such as Suffolk County, and to help compensate for a shortage of psychiatrists, social workers, and other therapists. Among the groups receiving additional state funding are GN Guidance and Counseling Services in Hicksville and Outreach Development Corp., which has centers in Greenpoint, Brooklyn, and to Bellport and Suffolk. Both nonprofits are also getting startup funds to establish crisis stabilization centers where clients are assessed in under 24 hours and connected to treatment services. Jeffrey Friedman, chief executive of CN Guidance, said his agency had received approximately $1.5 million in funds for a crisis stabilization center at its Hicksville facility. Patients can stay there for a maximum of 23 hours and 59 minutes since it's not a residential facility. Currently, when people in crisis, often they're brought to the emergency room, and the ER can be full of stigma. It can traumatize an individual, and more often than not, it's not an appropriate place for care. What we're building here is an urgent care for mental health, which he said he hopes to launch by early 2025. We're building a center that will be open 365 days a year, 24 hours a day, 7 days a week. Open Christmas and New Year's. When they come here, they get something to eat. They can take a shower. They can do the laundry, watch TV. All the time they're in the center, they're being assessed by professionals, a psychiatrist, a social worker, and a nurse. After the assessment, self-treatment is set in motion. Krista Whitman, Vice President and Chief Operating Officer of Outreach Development Corp., said the organization is in line to receive $1.25 million for its own crisis stabilization center and another $825,000 for suicide prevention and crisis services. It's still not a lot of money. I mean, consider how much money we're spending on illegals right now in the state that could go to citizens. So it's an improvement, but it's still a pittance, in my opinion. Representatives are currently scouting for a building in mid-eastern Suffolk to lease for the center. Our goal is by the end of the year we'll have a location, and like CN Guidance, individuals can only stay for 23 hours and 59 minutes. So more need, fewer beds. According to a report last month by State Comptroller Thomas DiNapoli, the mental health needs of New Yorkers have greatly increased. The report cited a 23% spike in the number of residents seen by the state's public health system between 2013 and 2022. At the same time, DiNapoli's report said the increase has coincided with the decline of 990 inpatient psychiatric beds in the state, almost 200 on Long Island, between April 2014 and December 2023. So again, this increase is not even going to get back all the cutbacks that we've made over the years. State officials have said they are increasing inpatient beds and adding an assortment of community-based care options ranging from mental health clinics in communities and schools to mobile units and housing programs in order to meet the surge in demand. Michael Scarpelli, Executive Director of the Behavioral Health Science line at Northwell Health through its South Oaks Hospital, a 202-bed psychiatric hospital in Amityville, is on target to open an outpatient clinic and a partial hospitalization program in Riverhead, providing mental health services to children from age 5 to young adults by the end of 2024. The partial hospitalization program would operate from 8 a.m. to 4 p.m. Overall, he said Northwell has 533 total inpatient psychiatric beds in a health system that includes Nassau, Suffolk, Eastern Queens, Manhattan, Staten Island, and Northern Westchester. We ended up in Riverhead because there's not a lot of resources for children out there. Asked about gaps in service, Capelli said some patients in Suffolk have to travel long distances for mental health care. Folks sometimes struggle with transportation. The further out east you go, there is more mileage to cover. To address some of these issues, Stony Brook Medicine is seeking to expand its outpatient substance disorder clinic in Riverhead via a state license to improve access to individuals with mental health diagnoses, said Susan Wilner, Assistant Director of Behavioral Health Services Operations. She shared that there are 40 inpatient psychiatric beds at Stony Brook Hospital and 23 at Stony Brook Eastern Long Island Hospital in Greenport. Both hospitals also have outpatient behavioral health services. Colleen Merlot, Chief Executive of the Ronkonkoma-based Association for Mental Health and Wellness, said her organization supports proposals to bring back inpatient psychiatric beds since they were taken offline during the COVID-19 pandemic. She said that her group believes people can be best served in the community when those services are adequate. Merlot lauded the huge investment in New York State for mental health services, but the truth of the matter is the mental health system has been underfunded for decades, so it's going to take multiple years of investments of this level to get us up to a place where we're able to meet the demands and needs of our communities. Dr. Leslie Marino, president of the Suffolk Medical Center Society, who is a psychiatrist, said while inpatient beds are coming back online, it's been a slow process, citing as a major reason the difficulty in hiring psychiatrists. Long Island has a high cost of living, but psychiatrists in public sector tend to have lower salaries. And this is the issue that we have, is that there's no housing for people making these lowest salaries. From what I've heard, a lot of inpatient facilities, the holdup is recruiting doctors. McQueen, of the Mental Health Association of Nassau, agreed that the availability of psychiatric access has decreased. There aren't enough psychiatrists. There aren't enough clinics. Scarapelli of Northwell also noted that individuals have retired or left the healthcare field. That's something that we need to be working on. He said Northwell is developing 2 new psychiatry residency programs to boost staffing. One is at Lenox Hill Hospital, Manhattan, and the other is going to be at South Oaks Hospital. We're hoping to have that starting in July 2025 at Lenox. We hope to start at South Oaks in 2026. Signs of progress. New York State's Office Mental Health Commissioner Dr. Ann Sullivan pointed to the state's $1 billion investment in mental health services as a way to make inroads toward increasing access, including adding 700 inpatient beds, 500 in the community, and 200 at state institutions, including 50 at the state's Pilgrim Psychiatric Center in Brentwood. And I'm glad that they're doing that because, there have been attempts to close that facility down, and that would be a big mistake. And the significant expansion of community-based services such as certified health centers. She said the health centers will be tripled in the next 2 years, going from 13 to 39. There's one on Long Island now, she said, in reference to the CN guidance. There's also the expansion of ACT teams, which are mobile units that meet people in the community, including Long Island. ACT stands for Assertive Community Treatment, which the State Office of Mental Health described as multidisciplinary, evidence-based teams that provide comprehensive and flexible treatment, support, and rehabilitation services to individuals in their community. Friedman said CN Guidance has 56 programs geared towards supporting people who have mental health and substance abuse issues, which he has said have reached 30,000 people on Long Island annually. Programs include a mobile recovery unit, an RV, and a smaller van dispatched throughout Long Island. The unit includes peer counselors, nurses, and therapists who meet people in parks, at train stations, and elsewhere. They provide information, Narcan training, which teaches how to recognize an opioid overdose and administer the overdose reversal drug naloxone, and conduct mental health assessments. The mission is to connect people who are suffering from behavioral health issues to get them into treatment. The rooms in the RV are outfitted with computer monitors where the on-site staff can connect someone with a psychiatrist remotely who can assess the individual. Nick Stahlman, an outreach and recovery peer specialist with CN Guidance, explained how a typical encounter with the RV staff might work. We park the RV, we set up a table out front, we pull the awning out, we have a nice little area out front that's inviting. We have a sign inviting people to take Nartine training, but also the Hope Rides Here logo on the side of the back of the van. A lot of the times it's a conversation starter. Staff members explain the services that are available and how people who need them can be connected to treatment and try to move forward with their lives. As recovery peers have been through that. We have been real-world, lived experience in both mental health and substance abuse. Stallman added that often they might hear someone say, "You don't understand, you don't know what it's like." So us as recovery peers, we do know what it's like. We have been there. We show them that recovery is not only possible, but it's expected. So a lot of this is geared towards substance abuse. But, I mean, it's a start. It's a start. And this is in Newsday, so if you want to check it out, newsday.com, and I'll provide the links below. I suggest you read that so you can, it's in here, push for comes from mental health access here. So these are the two right here that I just read to you. So click in the links below. And good to see somebody covering this because it's an important issue that is a crisis on Long Island. And the fact is, it's not just the mental health workers. We have bus drivers. People can't afford to live here, and these housing prices, as you see, median home, we got to do something about these housing prices. I honestly think maybe it's time for direct state regulation of them, or something. But I can talk about that in another video. So that's all for now. Thank you for watching. And again, Newsday, thank you for covering these stories because South Shore 12, they don't feel like covering news anymore, it seems.